And the first two speakers, actually the first three speakers, are going to talk about how they personally benefited from Obamacare. And our first person I want to introduce is Ruth Thompson. She's what I would call a super political activist, always volunteering for all kinds of things. Her primary interests are women's health, and I think basically I could just say a mega volunteer. Let's welcome Ruth Thompson to tell her story.
Sure. Thank you, Rick. My story is actually my daughter's story, but I have her permission to share it. The December before enrollment into the Affordable Care Act, before the big marketplace opened, my daughter signed up in December of that year to enroll. She was a young woman who was doing all of the right things. She was working full-time, she was going to school full-time, and she was also working a part-time job as well as starting a small photography business. So she was really working hard and trying to get an education and trying to do it on her own. She lived in Illinois, and my husband and I had just moved here. And so she enrolled in Illinois' Medicaid program through Medicaid expansion. And early January, she had again enrolled, and we knew that she was going to be eligible, but she hadn't officially received a card or been notified that she was officially enrolled. And she became quite ill and tried to delay going to the doctor for a while. And you know, Mama Bear kicked in and said, "Get your butt to the doctor." She went to the emergency room, and it was discovered that she had a large fibroid, and it was going to require a pretty costly surgery. Because she didn't have insurance, they ended up keeping her overnight for observation, giving her 3 units of blood, and sending her home the next morning. So immediately the next morning, I and the doctor who treated her in the hospital, and she began calling Medicaid in Illinois and pressuring them to get her application through so that she could be treated. And after about a week and a half or so, she did manage to get enrolled in Medicaid and had the surgery. It took two additional hospitalizations, including the surgery and 2 more units of blood. And all told, the hospital, the OR and ER cost and the doctor's cost totaled in excess of $78,000. Now, this was a young woman who had no health insurance, even though she was doing all of the right things and trying very hard to be a productive citizen and make her life better on her own. And she was also, at the same time, preparing to move in February of that year to Texas to be married. And so were it not for the Affordable Care Act, my daughter would have had 3 options. She could have started her new life with the $78,000 debt. She could have walked out on that debt and left a small rural critical access hospital network holding that debt, or she could have died, because that's what it would have amounted to. And so the Affordable Care Act saved her life in one way or the other, either her quality of life or her life altogether. And I think it's important to note that if she had had insurance all along, the condition that she had could have been detected in a doctor's office much earlier and been handled right there in the doctor's office, and would have cost a fraction of that $78,000. So that is my Affordable Care Act story. And this Mama Bear is going to keep fighting to make sure that my daughter and all of the women like her and all the people like her have access to affordable health care.
The next individual who's going to tell her story is Rachel Basan. She is employed at the Iowa Library for the Blind, and she's going to talk about how she ended up with inadequate health care before the ACA because she aged out of her parents' plan. Let's welcome Ruth up here.
I speak better from writing, so I'll speak from what I've written. My name is Rachel Bussin, and I have group insurance through my employer. So why am I here? Well, I wasn't always so lucky. I graduated from college right before the 2008 recession hit. The Affordable Care Act did not exist yet. and I couldn't find full-time work. And I had aged out of my parents' insurance plan. The only insurance I could afford on my part-time wages was a catastrophic policy that covered nearly nothing. No doctor's visits, no medication, no lab work, no x-rays. And when I was sick or hurt, I stayed home and prayed it would not get worse. I avoided doctor's visits and medication that I needed, and most of my peers were actually in the same boat with me. With the Affordable Care Act, decent insurance is finally available. Young adults can stay on their parents' insurance plan longer, giving them time to finish school and find jobs so they can purchase insurance on their own. If the Affordable Care Act is repealed, millions of people will be forced to avoid needed care out of financial necessity, or they can visit emergency rooms and, unable to pay, their bills will be absorbed by the hospital or by the state of Iowa. Repeal will not save us money. It will merely shift the costs and increase the suffering of fellow Iowans. For the sake of myself and others, please stand up and help prevent the repeal of the Affordable Care Act.
In February of 2015, I came to Iowa to cover the caucus. The plan was I was going to leave after the caucus, but I got sick while I was here on dialysis, so I ended up staying. I had health care when I lived in California with my employer, but then I moved to Washington to set up a DC bureau, and so I lost the insurance because California Blue Cross Blue Shield couldn't keep me on the plan. So I had to shop on my own. And I applied for a lot of plans that I could afford, and my employer was willing to pitch in a certain amount, but I would get denied, and the reason I would be denied, it would say body type. And they would say, we can give you a plan, but you got to take this plan. It was a lot more expensive than a lot more than I could afford. So for years I went without health care, and the last time I was on health care, they said that I was borderline diabetic. They didn't start me on insulin or anything then, but they knew it was coming. And so I went years without health care, and before I got on Obamacare, and immediately diagnosed diabetic, and they put me on medication. Then I moved here to Iowa, and after a while I started having high kidney counts creating, and finally they decided that I needed dialysis and to get on the transplant list. But my doctors pretty much said if they just started treating me when I was borderline, or when I had the diabetes in the first place in the beginning, I probably wouldn't have the kidney damage and everything else. So if it wasn't for, if they covered pre-existing conditions then, I would have had no problem. So Obamacare in that sense saved my life.